Top U.S. health officials say that while we don't know what will come after the Omicron variant, we're in better shape than we were, 2 years ago. That's thanks in part to better testing, vaccinations, masking, and treatment capabilities. And some shocking numbers, better yet today, when it comes to mental health and suicide among our young people. Between 2007 and 2018, suicide rates among people ages 10 to 24, you won't believe this, increased by 57%. And recently released numbers from earlier in the pandemic shows a substantial increase in the number of suspected suicide attempts showing up in emergency rooms across the country. Children's Hospital in Colorado has taken a proactive approach by appointing its first ever mental health in chief. All right, joining me now to talk about this first of its kind move by Children's Hospital in Colorado and how hospitals around the country could actually benefit from copying them. Beth Henson, she's a behavioral and public health expert. Beth, it's a pleasure. Welcome to BNC Live.
Thank you.
It's our pleasure. Suicide is the second leading cause of death for young people. Now in Colorado, it's number one. Is this the right move, or should it have come a lot sooner?
I think that the state of Colorado, unlike like many other states in the nation, have always had systems of care in place prior to COVID. However, since COVID has been here for several years now, we're going into the third year, what we're seeing is an overwhelming of our systems that are in place. So they made this move, I believe, to sort of stem the tide of incredible rates of suicide attempts among their young.
Yeah, and I meant to ask you, was this the right move to change that? But you answered right on target. So thank you, Beth. Talk about how monumental this move is, right? And should other hospitals around the country address this issue? I mean, suicide, the number 2 leading cause of death in Colorado, number 1. I mean, that's just heartbreaking.
It's incredibly staggering when you think about it. But we also have to think about things that have happened, say, over the last decades. Schools, think about Columbine, right? We think about other tragedies. They're happening at schools. Children are afraid across the nation. Security is an issue there. In the state of Colorado, Dr. Liao, the new commissioner for mental health, wants to make schools be a place where problems with children, potential suicidality, can be assessed and addressed right at the point where the children are. Doctors' offices, other places. So developing out the system further is something that we should be doing as a nation. The federal government should really take the lead and bringing all the states along it into some sort of baseline of a real comprehensive emergency mental health system of care.
Yeah, well, speaking of that baseline, and Dr. Liao, whose background in New York City hospital system, as you mentioned, talk about how she is going to be the person to create that baseline.
She will indeed. I believe that the doctor is going to take a look at what's already available in the states. I listened to her interviews. I read her interviews on yesterday in preparation for today for my time with you. And it appears as if she's going to take a system that was already in place and simply enhance it. One of the things I read that I thought was a really novel approach is children have regular checkups at different ages that are looking for their milestones in their human development, right? You know, like when you have a little one, they have the 1 month checkup and then, a few months down the line.
Yes.
As children go through this system of care with these milestones and these checkups that are already in place, this physician is going to incorporate counselors. So instead of a child, say, filling out a checklist at these visits over the years, there'll be a counselor there that can just sort of chat and have a conversation and assess so that a child gets in front of a mental health professional briefly for assessment at more frequent time periods over the child's human development. that will hopefully stem the tide and identify problems before we get to the point of suicidal ideation and actual suicide attempts.
Yeah, Beth, I think you're on. I think you're tracking exactly what needs to be done because I'm just trying to understand the undeveloped mind. Suicide, again, leading cause of death for people as young as 10. What
10.
convinces a
And
young
for Black
person?
children, for Black
It's
children,
younger?
yes, 10 to 14. 10 to
What
14.
convinces a young person who's only lived a decade on this earth that life is so bad that they want to kill themselves?
All I can say is look around. Look at the world. Look at the state of our country. Look at what happened to George Floyd. Look at what's happening to people in other countries that they see on these devices that they carry around, our cellular phones and our pads. They're being bombarded by bad news in many instances. Man's inhumanity. Black children, on average, there were statistics say that they get at least 10 negative messages a day on the handheld devices. Friends chiding them, people being negative. And so there's a lot of negativity, there's a lot of war, there's a lot of strife, conflict. There are a lot of socioeconomic reasons. A lot of our children that are Black and brown live in poverty in this nation by design, a systemic design. So there's a lot of reasons. And with an undeveloped mind, they don't have the coping mechanisms quite yet in place that you and I do or others. So that's why I think there are many factors, but those are some of the factors.
Beth, we got to save our kids. Thank you for dedicating the time to talk about this vital issue. I look forward to welcoming you back. Have a good weekend.